Our inclination when we have something traumatic happen to us is to avoid the thing that happened, or the thing that we're afraid of. And the more we avoid it, the worse the fear gets. We do a certain type of therapy called exposure therapy with our behavior therapists, which is systematically introducing the person back to the traumatic trigger, but while practicing calming techniques. It really is like a miracle. We have people driving within like a month or two, tops. If they do it, if they come to therapy and they really, work with the therapist, it can get better very quickly.
Welcome back to our podcast. Today we have Lori Goodman with River Shores Counseling. How are you doing today?
I'm doing fine, thank you. Trying to stay
Good.
cool in this heat.
I am telling you what, it's fun. I was born and raised here like all my life. And I feel like every year, every summer, I'm like, is it always this hot? It is always this hot. It's miserable. I think we went grocery shopping yesterday, and by the time I got to the car, I was like, okay, yeah, I need to go for a swim.
Yeah, it's a good day to do a podcast, to be indoors.
Yes, be indoors with a cool AC. That is for sure. I'm really excited to speak with you today. Really, really excited. And I know there's so much I'm going to learn from you too. Because here at Integrity, obviously we're seeing patients who are having these, physical injuries, and a lot of people don't understand, like, yes, you can have those injuries, but mentally there are injuries that also come from an accident. And so we can kind of kick it off. Let's talk about the biggest misconceptions about trauma. So for this one, as many people think that if they weren't seriously injured, they should be emotionally fine. Is that true? And then let's kind of like walk through that a little bit and what you typically see from a day to day.
Sure. I mean, the trauma research is so interesting. It's logical to think that if you were in a crash or in, a premises incident, that if it was kind of mild, someone looking on thinking it was mild, that you wouldn't have a lot of PTSD, and just the opposite too. That if you were in some horrendous accident, that the PTSD would be off the charts. But actually, it's really how we perceive what happens to us that determines whether or not we have PTSD or not. So we've treated some people that were in situations that would, make our toes curl, and they're not really having many symptoms. And then sometimes people who maybe were in a little fender bender and they can't drive. They're terrified to get in the car. And of course, sometimes, a lot of the time, those really serious accidents with tons of physical injuries does result in PTSD as well, but it's not a guarantee. That's why it's really important to do an assessment.
And do you think that's so interesting, by the way, how you said there's some where the crash or the incident is very significant and maybe they might not have PTSD, but there could be a little fender bender, and there, are situations where a patient doesn't want to drive. So do you know why that is, or if there's studies based on that as far as like how people feel? Like, walk me through that.
I mean, it's a great question. I don't think they have it totally figured out yet, but a lot of it has to do with past experiences and how we react to those experiences, our disposition, something called resilience, which is how well we adjust after something bad happens to us. Sometimes that might be genetics. A lot of it can be genetic.
So interesting. And I'm sure too, some people compartmentalize maybe better than others, and maybe that could come out later on.
Yeah, absolutely. Just because someone looks like they're dealing well with it, maybe in the beginning, it's like when you talk about someone who doesn't cry at a funeral and they just can't cry, and then 2 months later they're grieving and they can't stop crying, so our emotions are funny, strange little things.
Yeah. And everyone deals with it all differently.
Exactly.
Well, we had a patient, oh goodness, I feel so bad. I mean, I feel bad for all of our patients that are here because they're going through something that they, obviously didn't expect to happen. But we had a patient last week who had gotten into an accident. I want to say it was maybe March. I mean, was hit on from a semi. It was a semi accident.
Yeah.
And was recommended a surgery. 2 months later, got into another horrific accident. And when I was talking to her on the phone to get, her scheduled for this appointment, we offer Lyft. That is one thing, because obviously after an accident, cars can be totaled,
Hmm.
but there's also another side of patients who are like, I don't want to get into the car right now. I don't want to get behind the wheel.
Yeah.
And I think it is so much more common than we think. Um, and so I felt so bad. So when I was scheduling her appointment, that was one question that she had, was a sense of, I this has been back to back. I feel so awful. And this actually might be a good patient that we can actually send your way,
Hmm.
because I mean she does not want to get behind the wheel at this point, and
Well,
I
that's, what
completely
we treat
understand.
all the time. I mean, that's
Yeah.
our most common, I would say, issue that we treat, people that are afraid to drive after an accident.
And how long do you think that typically takes? Like if let's say that were me and I got into, a really bad car accident, and I was really anxious as far as getting into a vehicle, getting behind the wheel, and Lori, I came to you and, we had therapy. What is a time frame? And I'm sure it's a little bit different for everybody else, but is there like a realistic time frame, I feel like,
Yeah,
for
what's
that?
really interesting is that it actually gets better pretty quickly, you know? Because our inclination when we have something traumatic happen to us is to avoid the thing that happened, or the thing
Yes.
that we're afraid of. And the more we avoid it, the worse the fear gets. So we do a certain type of therapy called exposure therapy with our behavior therapists, which is systematically introducing the person back to the traumatic trigger, but while practicing calming techniques. And it really is like a miracle. We have people driving within like a month or two tops, if they do it. If they come to therapy and they really, work with the therapist, it can get better very quickly, which is so hard to believe because the terror inside about it seems just insurmountable.
Yeah, I went on the inside, or not on the inside, but like you said, I know it could be so much bigger than what it actually is. But the exposure therapy, I mean, I've heard just from other types of exposure for therapy and stuff like that too. And like you said, it's like the more you avoid it, the worse that it gets, because the fears increase and there's so much more that go into that. So that is absolutely amazing to hear, as far as there are some cases where, after a month, these patients are like, you know what, it's not as scary as what it actually all like entails to be. And so that's exciting to hear that it's something that could be, done pretty quickly. And I'm sure there's other people too where, it might take a little bit more time, just depending on what they've been through, how long they've been holding off on,
Mhm.
seeing a therapist as yourself. But I'm happy that there is somebody like you in our field, which, by the way, everyone who is, listening and watching, Lori, I feel like you are the only person in this field, at least that I know of, who sees, patients after an auto accident or a slip and fall case and is helping from a PTSD perspective.
So far, I mean, I think there are a few others, but not on the scale that we are. But there was really a hole there. There was no one there to see these poor people. The first client I ever saw, it was a favor to one of my attorney friends. She said that her client was having panic attacks after an accident, and the accident was, I think the accident had been going on 3 years, and she was still panicking. And I said, why can't she find a therapist? That's very easy to treat. And of course, she explained to me how this whole thing works. And it was very satisfying to help someone because she got better very quickly and she was so grateful. It's just a lot of therapists won't do this kind of work, because for a
Hmm.
lot of reasons. So,
Which again, we are so thankful that Laura, you're in this space to be able to help out, because even in the last podcast that I had when I was speaking with a chiropractor, it's like, you have this one patient and you have all these people that are surrounding them to get better. And before you came along, it really sounded like there was no one else to kind of bridge that gap. You've got someone who's there for adjustments. You've got someone there for, orthopedics or, neurosurgery. You've got someone for pain management. There's all these different things to help this one patient get better. But it sounded like there was just that one missing piece to kind of bridge the gap to, you know, bring this patient back, to health in more ways than one. And so, again, this is another reason why I was really excited to speak with you today, is because this is so much more common than what a lot of people think.
what's interesting too is that a lot of times we treat clients that won't go to their physical therapy or they won't go to their medical appointments because they can't drive. And so not only are they not getting the emotional support, but they're not getting the physical recovery because they're afraid to go to appointments. So we help a lot with that too.
And that's a huge thing when it comes to their case as well is, you've got to show the other side that, you're willing to treat because, you're hurt, which is to have to prove that you're hurt and everything in between, as we know on this side. But I didn't even think about that, them not even making other appointments
No,
because, of course, they can't drive.
a lot of times, doctors will call us and say, we can't get our client to come to appointments because they won't get in the car. And we have to, we do the treatment and then they're able to get back into their physical recovery.
Yeah. Holy cow. Well, I love speaking about this. What I want to know more about you, Lori. So can you walk me through how did you get to where you are today? Maybe let's start off with schooling or, what inspired you to become a therapist?
That's a long journey. We might need like 3 hours.
That is okay.
I'll try to give you the short version. But it seems so long ago, but I actually, when I was in college, I was a political science major. I was really interested in politics. And it was fun, but I didn't really, people always ask me if I wanted to be an attorney. And at this point, I might be able to, being in this
I say
world,
that.
like you could
I
go to
say that
law
all the
school.
time.
But
Yeah.
what's interesting is that all the 4 years I was in college, I was volunteering at a crisis hotline that the school put on. We got trained to talk to people who were in crisis emotionally, and I really loved that work. And then eventually a light bulb went off, like, oh, I think this could be my career, and that's kind of how I changed direction. And then I ended up becoming a social worker.
Okay. And how long were you a social worker for?
Well, I still am.
Well, still are. Yeah.
So how
But
long
oh,
have
sorry. Going back to, sorry, for like therapy and stuff like that.
you mean to being a therapist? Or
Yes.
I was a therapist from the very beginning. I always wanted to do therapy, so for over 30
Okay.
years.
Holy cow. That's amazing. That just goes to show how much knowledge and all the senses that you have there in therapy. And remind me, what year did you start doing, or I guess seeing personal injury patients?
Well, that first client was, 6 years ago, I think. So it's been about 6 years. And now we have a staff of 6 therapists. So, I
Wow.
mean,
Okay.
like you said, there's really no one doing this. And
Mhm.
the more people found out about it, the more they'd say, we have someone who needs your help.
Yeah. Yeah.
So
No, that's awesome. Because I think whenever I met you for the first time, I want to say it was 20. Well, did you come to our grand opening that was here
I think I did.
in our office? Yes. Okay. So that was 2020, but I'm pretty sure I met you. Yeah, I think it's been since 2020. And I
Wow,
want to
that's
say,
crazy.
isn't that crazy? Wow. And I want to say at that time when I met you first, and I could be wrong, but it was you and maybe two other therapists, or have you always had a
In
good amount of therapists
2020,
with you?
in 2020, it was just me. I only had a few cases because my friend gave me another case. She had, and then she told two friends, and then they told two friends. And so the first few years, it was just me. And now
Wow.
it's six of us. So
Okay. Now, are you seeing patients virtually or are you seeing them in house as well?
we do all telehealth because during COVID, we went to all telehealth and we just stayed there. All of my therapists are in different locations and we see people all over the state. And sometimes in other states, we're licensed in other states as well.
Okay, I was going to ask that too, if you guys were licensed anywhere else.
Yeah,
Because
we're
there are
like,
some attorneys that we work with who are licensed in other places and stuff like that. So that's really good to know.
yeah, we're licensed in Georgia. We're licensed in Texas. It just depends on the state. Illinois.
Yeah.
So it's,
So we're just going to keep marking all the different spots of the United States
yeah,
at this point.
yeah.
Um, how did you begin specializing in trauma?
Well, I mean, I think as a therapist, you,
Kind of exposed to that?
yes, you're exposed to a lot of trauma. I did a lot of eating disorder treatment for years. And unfortunately, a lot of people with eating disorders have a history of trauma. So I did a lot of trauma work, seeing those kinds of clients.
Okay. And for you, I know we kind of talked about this already too, but the main patients that you are seeing right now are patients who've been in an auto accident as well as slip and fall cases as
Right. And
well.
right, different kinds of premises like people who've who've experienced
Oh,
violence. Who,
sorry, Lori. My light just went off in my office. Give me 1 second. There we
oh, there
go.
it
I'm
goes.
like, I'm here. It's automatic light. Sorry about that.
That's okay. That's okay.
Go
We
ahead.
see people who've been attacked, who've been in violent incidents too. We see children who've witnessed violence or involved.
Mm.
There's lots of different ways. You learn there are lots of different ways people can be traumatized, unfortunately, in this field.
Do you guys see a lot of dog bites? I feel like
Yes.
we haven't treated in a while, but I feel like that was one thing that we were seeing constantly is
Yeah.
dog bite
We see a
incidents.
lot
And I
of
could
dog
obviously
fights.
see the trauma and PTSD that could come from something like that as well,
Yeah, and like attacks from people on other people too, like assaults. So we get a lot
which
of
is
those.
hard,
Hmm.
which is hard, but it takes a really special person, like you and your therapist to be able to work with somebody to walk through these as well.
Right, same with you
Um,
guys, definitely.
Yeah, no, it really is. And the more that I've had these podcasts with, other people who are also in the personal injury world, it really goes to show how amazing it is for everyone to be able to step in this field, especially the personal injury field, which a lot of physicians don't want to do, right? And so it makes it, I don't know, just my heart grows so much more for the people who are on the personal injury side of everything to you know, treat these patients to get them back where they need to be while they have these cases open. And and I'm so happy here in Jacksonville that we have a lot of really good people and specialists and chiropractors and pain management physicians and
Hmm.
personal injury attorneys and you guys as well to be able to bridge the gaps to get these people back to where they need to be.
I mean, it's kind of a high barrier to entry to get into this world, but on the other hand, the population is really great to work with. Like my therapists love their patients, because they come from all walks of life. You meet all kinds of people. You can help people from every socioeconomic class. It's really, you really get a diverse group of clients. And they're usually so very grateful to receive the help. So it's very fulfilling.
No, I think so too. And I totally feel that.
Mhm.
So I want to also walk through with understanding PTSD after a car accident or fall. So can you explain what exactly PTSD is?
Well, there's a diagnostic manual that kind of outlines all the symptoms of PTSD, and there's a whole list of symptoms that you basically have to exhibit after an incident for at least 6 months. And they include nightmares, flashbacks, panic attacks, trouble sleeping, reliving the incident. I don't have them all in front of me, but there's
Mhm.
a whole list of symptoms that you have to experience with, 6 months or longer. And there's other,
Okay.
not everyone we see has PTSD. There are other diagnoses. So just because, just you don't have to have PTSD to benefit from counseling. For example, you can have panic disorder. If you're having panic attacks, you
Mm-hmm.
can treat that. If you're depressed, you can't get back to work. You can't get up because you're feeling, we deal with a lot, you do too, a lot of
Yeah.
people with chronic pain. Just helping people to manage chronic pain is very difficult, like just emotionally to be able to live with that every day. So we do that as well.
Okay. And that's a great point as far as like it's not just PTSD. You've got a lot of people who are having panic attacks as far as like what we were explaining early, getting behind a wheel. It seems so easy to everybody else, but someone who's gone through something really traumatic like that, it can feel like so much more.
Yeah. We
And
also, I'm sorry to interrupt you, but we
no, that's
also
okay.
treat a lot of people with traumatic brain injury and just to help them learn how to live with that injury emotionally and physically.
That is so interesting. So let's talk about that a little bit more because TBI is also another thing. That we don't treat that here, but we do send out to neurologists who treat TBI. But how walk me through the treatment for someone who does have a TBI?
Well, again, I'm not the behavior therapist, but I'm going to try to explain it because they're just
Yeah.
incredible. But usually, our clients will see both a mental health counselor who kind of helps with the emotional part of it, someone to talk to, how my life has changed after this injury, which, with a TBI changes your whole life. But also, the behavior therapist can help them to develop schedules and ways to remember things, how to get around their apartment, how to not forget, how to give reminders. There's lots of different ways that help them kind of adapt to living with that injury.
Okay. Yeah, again, just another person to be able to have along the way to help them get back to where they need to be. And I know even with the TBI patients and just other patients going back to PTSD, sorry,
That's
I feel like there's so much in this field that's so, a piece or just something I want to talk about a little bit more. But um, are there definitely cases that you think where, patients been into an accident, it could be 6 months later, which I know we kind of talked about in the beginning, where it's, you know, patients can get in insane accidents and it's fine, but maybe they're just kind of holding into it at some point and then boom, it's released. Do we kind of have an idea of how that's released at some point, but it wasn't like that in the very beginning?
Well, that's very interesting. I think honestly, a lot of it is that people try to convince themselves they're not traumatized. They try to white knuckle it, and like a lot of times, you, like tough guys, like big
Oh, it's so
construction
accurate.
workers, or
Yes.
we love our
Yes.
construction worker clients and our big truck drivers, but they're usually like, I don't have feelings, they're like try
They're like, I'm
to
fine. Everything is fine. Everything's fine.
exactly. So I think a lot of that isn't that they just didn't feel anything. They just pushed it away, compartmentalized, like you said. But sometimes it can just surface later, like something reminds you of the accident or something adjacent to it reminds you, and it can just when you relax, it kind of when the body's relaxed, that's when symptoms can come up when you're not as guarded,
Oh,
right?
that's interesting. Huh. It's almost like when you're relaxed, that's when your emotions like, all right, well, it's time to release everything that we have
Exactly. Like we
building
have
up
to
in
feel
here.
safe to let our feelings out.
Oh, the mind is just such a crazy
Yeah,
thing,
it's
too.
fascinating. That's
It
why,
really
and
is.
a lot of people just are in denial. It's funny because I just had two friends that got into accidents like in the last month, and I saw them in real time denying denying what happened to them. And they were bad accidents.
Just, waving it off as it wasn't as bad as what it was, or denying it in what way?
Just they were in terrible accidents and you could tell they were rattled, but they didn't want to admit it. Because I think
Oh,
especially our culture tells us that we're wimps if we are weak. We're
yes.
weak if we show feelings or if we cry or if we, have a panic attack, but it has nothing to do with that at all. I mean, the PTSD research was all based on soldiers, and they're the toughest people in the world.
That is a fact. And that's such a great way to kind of put that to explain PTSD to somebody.
Mhm.
So, in also speaking about like the mind and body connection, can emotional trauma actually increase physical pain?
Yes, because if you're holding your anxiety, your muscles, I mean, you could tell me more about this is more your area, but
Yeah.
if you're
Yeah.
holding that and tensing up, it can definitely make the physical pain worse. Headaches, it can make your TBI symptoms worse. If you're holding all those emotions inside and you don't have coping mechanisms.
Mm. So also with us sending out to like physical therapy, I'm just thinking about like therapy in general, right? With physical therapy, you're doing all of these different modalities to, for strengthening and everything else like that. But you also have the therapy, to kind of help with your mind as well, but to help with releasing of your pain. I'm just trying to tie those two together because I feel like those two are something that's very, very important.
Yeah. I
But
do think they
that
help each other, and it's support. I mean, the more support you have emotionally and physically, the better you're going to get.
no, that is so true.
I mean,
That
think
really
about
is.
people who are going through cancer treatment. They have support groups for them.
Yeah.
They don't have to assess them. I mean, they're just put right in a support group usually.
Yeah. Yeah. I could see that too. I know I really wish it was almost something that was just given for every patient, who gets into an auto accident, just because it's so true. It's like, the accidents happen, and then let's say that you are set up with an attorney, and then you start, chiropractic care, and you start here and here. I just really and truly, I wish, that therapy was something that was just automatic. Like, okay, hey, like we want to make sure you're okay physically, but mentally we need to also make sure that you're taken care of. Because if you think about it, a lot, and this happens also from an orthopedics and neurosurgery standpoint, is a patient can be treating with us, maybe they don't have private health insurance, but they're treating with us for, let's say, a year or so. Maybe they've done injections, maybe they've done or had surgery, but we're still treating them along the way. Case is closed. but they still have stuff that, might be wrong with them later on.
Mhm.
And so I feel like in this same instance too, with your mental health, is you can be treated everywhere else, but that can be something that's just lingering along the way. And that can start connecting into a ton of other things,
Mhm.
and like I said, I just wish that was something that was just automatic when you're already seeing all these other providers of, "Hey, let's go ahead and get you checked out this way," just to make sure that, hey, if you're having therapy and you're working through this, maybe that can help you relax to where then boom, you're going to get better mentally. You're going to get better whenever it comes to, getting adjusted or after injections. It all
Right, I
would work
agree.
so well together.
I mean, this is definitely a more positive environment for mental health than it's ever been. I
I
think
agree.
since COVID, it's become a lot more positive and acceptable to go to therapy. So it's getting better, and there are definitely, attorneys and medical providers that get it, and will kind of send them right away. We'll assess them for symptoms, and so it's getting better.
It is, and like you said, that's such a great point. Because even, I've been on this earth for almost 32 years, and it's funny to see how things were while I was in high school, as far as like, therapy and talking about your feelings and emotions, and how everything was always kind of pushed to the side because no one wanted to talk about it because it was, I don't know, I guess people just felt exposed by talking about their feelings and in fear that they were different than everybody else. Where now, there's people that I know personally who are in therapy and talk about it. And I was like, I would never expect that.
I think,
But
oh, I'm sorry. I think one of the problems too is a lot of the clients we see have never been in therapy.
oh, that is a great
And
point.
so they might not be as open to therapy, or they just feel weird because
Yeah.
they never went. But a lot
Yeah.
of times they really love it, and they really do well and begin to value it.
So then that's a great question I would love to ask. If we have a patient that was here, hypothetical here, and we were like, hey, you know what, we really think that you would benefit from therapy. And maybe they were on, the edge of it. They didn't really know. They've never been in therapy before. What is something that you think that you would say to try to help that angle to try to get them into your office?
Well, what we usually do is we provide medical offices with a client self-assessment. So they can just take it and say, hey, if you have three of these signs, it's a good idea just to get checked out. And the other thing too is that you can tell them it's good to document your emotional symptoms anyway. It's good to have them documented, at least to be assessed. And then, that then the provider will tell you. And if someone, there are a lot of times we'll see someone be like, they don't really need it.
Yeah,
They're doing okay. They're so we don't just, treat people just to treat them.
of course. Maybe that's something that you and I can talk about too, is off the call of, that questionnaire that you have.
Yeah,
Because
absolutely.
that's,
We have
yeah,
for
because I mean, we're
children,
definitely
for
seeing it a lot
adults.
more.
We have it in Spanish and English, so there's a lot of
Okay.
ways. And that way the client can do it themselves. They have more agency. It's not just someone telling them, you
Mm,
need this, but
yeah. And for children too, because I know that you've mentioned that a few times. How young what's the age range for you guys and what you treat?
so our behavior therapists can see children as young as 2, believe it or not. So even nonverbal children can experience trauma, and they have nonverbal expressions of trauma, like they're wetting the bed when they didn't before, or they're wanting to sleep in the parents' bed when they didn't before, or they're having
Mm,
tantrums, or they're crying a lot, fussing. So they're fighting with their siblings. So we can treat children that young with the parents, of course.
yeah. And that's what's for us too, because we don't do the pediatric side of things, but we definitely see patients who have been in an accident. It's been as a family, and either there's children that are involved, and maybe children might not have the physical, injuries like their parents might have, or the other people who were in the vehicle. And so that's nice knowing that there is something that we can do, that you guys can do for the younger patients that can't be treated, with us or just anyone else in general.
Yeah, yeah.
So that's good to know. So for this one is to kind of wrap up everything into a bundle. Um, Let me see. Give me 1 second.
Sure.
Yes, just to kind of talk about like what's going on with your offices. So, what happens during the first therapy session?
So usually we set people up with two different intakes, one with a behavior therapist and one with a mental health counselor. And what they'll do, the behavior therapist will assess for behavioral symptoms like fear of driving, startling in
Hmm.
the car. There are a lot of subtle symptoms you can have, from an accident that still are symptoms. Like you flinch. A lot of people flinch in the car when a truck goes by them, for example. That's a symptom that you can't relax in the car. And so they'll do a whole list of behavioral symptoms, and then the mental health provider will assess for emotional symptoms like depression or anxiety, panic attacks, nightmares, trouble sleeping, trouble getting along with people in the house, all different kinds of mental health symptoms.
Okay, then that's how you guys kind of figure out
Right. And then
the best case scenario.
yes, and then all the symptoms are documented, and then we go forward with the treatment plan. So with the
That's
behavior therapist, that's probably exposure therapy. And with the mental health counselors, probably a lot of cognitive behavioral therapy and support.
okay, that's good to know. And for you guys, obviously, I know you work in the PI space, but do you guys also accept private health insurance?
We do not accept private health insurance.
Okay. You guys are in the same boat as us. I'm glad that we're not being told what to do by the, major medical
Yeah,
insurance
it's
companies.
unfortunate. It's just the more experience we got, the less they paid us. It's
Yeah.
really not and then you're fighting all the time with the insurance.
Yes.
So
It
that's
was the
very,
same issue for us. It was, the surgeons would recommend a surgery, and then you've got insurance coming back saying, well, that's not medically necessary. And then they should do PT for, 6 weeks, and then this type of injection, and then we can try this. And we were just like, we can't, these people are hurting. This is delaying so much treatment. And so it's been so much better. Now, yes, there are patients out there who have insurance, and I get it, they want to use their private health insurance. So totally understand that from that perspective. But, I'm glad that we're able to treat, these patients who don't have private health insurance, and to be able to get them the best treatment possible. And so for us, I know that I said that there was probably a patient we were going to send over. What is the best way for us to send a referral over to you guys?
it can be faxed. Our fax
Okay.
number is, I can tell you, 866-631-9482. It can be emailed to admin@rivershorescounseling.com. Those are the ways we usually receive intakes or
Okay,
referral
amazing.
requests.
And then do you guys have a website if there's someone who's watching and they want to check out a little bit more about you guys?
We do. It's rivershorescounseling.com.
Amazing. All
And
right, Lori.
we're
Well,
on
thank you.
Instagram and all that
Oh
stuff.
yeah, what is your Instagram handle?
I think it's,
As I put you on the spot.
I know, my assistant knows all this. It's at River Shores Counseling, I'm pretty sure.
Okay, I was gonna say, if not too, I'm sure on your website you probably have like the little Instagram
Yeah, we
toggle
do.
that'll take you right to your website. Amazing. All right, Lori. Well, thank you so much. I really do appreciate this time and sitting down with you, because this is something I feel like is just not really discussed enough in this space. And so I'm really excited and happy that we got to have this time to, talk about things together.
Well, thank you for having me. It was a lot of fun.
Of course, Lori. We'll talk soon.